Your booking appointment with your midwife. So your booking appointment with your midwife should happen at around 8 weeks pregnant. In this initial appointment, the idea is to map out your plan of care. To do this, the midwife will ask you lots of questions about your family history, things like history of diabetes. She will ask about your own health as well, any medications that you are on, any pre-existing medical conditions, allergies. She will ask you about any previous pregnancies, miscarriages, any children that you have and how their births went. From doing this, the midwife is gathering information to see if you need to be advised to have any extra care in your pregnancy from a consultant, any extra scans such as growth scans, or any extra tests such as a gestational diabetes test. Your midwife will also chat to you about your occupation, discussing any risks or concerns you may have in your workplace to do with your pregnancy. Also your home life, living situation, your partner or other support you may have when baby comes. Your midwife will offer you advice on exercise, diet, lifestyle changes that are advisable to make now that you are pregnant, such as reducing or stopping smoking, and reducing or stopping drinking alcohol, and also any pregnancy supplements that you need to take, such as folic acid. The advised amount for folic acid is 400 micrograms daily. Taking folic acid reduces the chances of your baby being born with a birth defect called spina bifida and other neural tube defects. Your midwife will chat to you about where you're planning to give birth. At this point, it may not be as detailed or decisive as a home birth or which birth unit you'd like to go to. If there is more than one hospital in the area, then at this point, it's more of a guide as to which hospital or area your care will be based under. This is so that you have your scans and blood tests recorded under the hospital or NHS trust where you are planning to give birth. After this appointment, your next midwife appointments will be at 16 weeks, then week 28, 34, 36, 38 and 41. If this is your first baby, you will also have appointments at week 25, 31 and week 40. It is up to you to call and book in to see your midwife for these weeks. Usually these happen at your midwife's clinic at the GP surgery. So you would call your local GP surgery to book an appointment with the midwife. If you have a consultant obstetrician, then you will also have appointments usually around week 16, week 28 and week 36 with the obstetrician at the hospital. Although sometimes it can be more frequently than this. You can have these obstetrician appointments instead of seeing your midwife that week. Or if you do have extra concerns, you can do both, depending on what you'd like to do or if your midwife needs to see you for anything extra that week. Your appointments for your obstetrician will be made automatically and sent to you through the post.